Defending Care Episode 3. 2 insolvencies a day. An administrator in Bavaria opens a spreadsheet on a Monday morning. The same spreadsheet she opens every Monday. It tracks one thing: whether the facility can meet this week's payroll and next year's payroll, not next month's, this week's. She is not incompetent. She has run this facility for 11 years. Good staff, good residents, a reputation in the community. She is looking at a number that keeps getting smaller, and she knows, as she has known for 6 months, that the direction of travel is not going to reverse. In Germany, on an average, 2 facilities like hers file for insolvency every day. Not every week, every day. Germany has one of the oldest populations in Europe. The demographic inversion has already occurred in many regions. More people needing care than the working age population available to provide it. Care worker wages have risen 25 to 40% over 3 years. The statutory nursing care insurance, Germany's equivalent of Medicaid in US, sets reimbursement rates in advance. Annually. The rates have not kept pace. The facility operator sits between a fixed revenue ceiling and a rising cost floor. Wages go up in real time. Reimbursements are set by statute in advance. The margin between them is being compressed to the point of non-viability. This is not a management failure. This is an architecture failure. In 2023, 1,097 care facilities in Germany closed or restricted supply. 130 institutions reported insolvency, up from just 26 the year before. Nearly 16,000 outpatient care places were lost in a single year. 130 insolvencies in a single year, up from 26, a 5-fold increase in 12 months. 33 care homes, 80 care services, and 37 daycare facilities closed in Germany in the first quarter of 2024 alone. The first quarter of 1 year, 150 facilities. And it is not confined to care homes. 3 out of 4 German hospitals ended 2024 in deficit. Nearly 89% of public facilities are facing serious financial distress. 3 out of 4 in the country that built the model for European healthcare. Germany will need an additional 322,000 inpatient care places by 2040. The system is closing beds while that need accelerates. When a facility closes, residents are transferred, often to facilities that are themselves operating at the margin. The caregivers disperse. And what disappears with them does not transfer. 11 years of knowing which resident prefers the window seat, which family calls on Sundays, which doctor signs the discharge faster, how to manage Tuesday evening when 3 residents need attention simultaneously. That knowledge is not in a spreadsheet. It is not transferable. It is not recoverable. It closes with the building. Now the United Kingdom. Germany has a statutory nursing care insurance, a social insurance model, contributions from payroll, rates set by government. The United Kingdom has a national health service, tax-funded, publicly operated, regulated by the Care Quality Commission. Nothing is structurally in common with Germany. 518 UK care homes closed in 2023. CQC registered care homes with nursing have declined 5% since 2017. Care homes without nursing have declined 11%. 518 in a single year. In a system that was supposed to protect the most vulnerable adults in England from exactly this. And the nursing home stock has been declining for 8 years. Not a sudden crisis, a structural erosion, year by year, bad by bad. Now, the United States, Medicaid, private payers, state by state regulation, nothing structurally in common with Germany or the United Kingdom. 774 US nursing facilities closed between February 20 and July 2024. The Medicaid compression mechanics mirror Germany's. Reimbursement rates set by state, set annually, set in advance. Wage cost move in real time. The margin compresses. The facility that cannot survive on the margin that exists does not survive. Growth accelerates the problem. More clients mean more staff, means more wage pressures on a margin already compressed. The agency owner with 120 clients successful by every measure, considering selling, is not failing. She is a data point. 3 countries, 3 healthcare architectures with nothing structurally in common, different payers, different regulations, different histories, different political traditions. The same direction of collapse. When 3 unconnected systems produce identical outcomes, you are not looking at 3 separate failures. You are looking at one structural force expressing itself through different local contexts. This distinction matters because the response to 3 separate crises is 3 separate solutions. A German solution, a British solution, an American solution. Each looking for the local cause, each missing the structural one. The response to one structural force is one structural solution. The force has a name. We call it the CareDrain. The systematic draining of economic viability, human talent, operational capacity, organizational stability, and owner resilience from care businesses worldwide. 5 vectors, all flowing in the same direction, out. The care systems of Germany, the United Kingdom, and the United States have spent the last decade responding to this crisis with incremental measures, better workforce incentives, higher reimbursement rates, technology adoption programs, better software. The data we just reviewed is the result. 2 German insolvencies a day, 518 UK closures in a single year, 774 American facilities closed in 4 years. The incremental response to a structural force is incremental failure. There is an architectural response, not a better version of the system that produced these numbers. A different paradigm entirely. In the next episode, I want to examine what that paradigm is, why it is structurally different, and why it is the only response proportionate to a force operating across 6 countries simultaneously. Full transcript, citations, and the Care Manifesto are available at anandchaturvedi.com. I am Anand Chaturvedi. This is Defending Care.